Hello, I am Juno Jung from the Medical History in Modern Korea. Today, Korean medicine has reached the level where it leads the world in clinical research and education. This growth is like Korean economy, which is often referred to the miracle of Han River. At the same time, we are also facing major challenges that require medical intervention, such as a low birth rate and a rapid aging society. Let's take a look at the achievements and challenges of Korean medicine now.
Case study: Globalizing Korean Medicine.
In April 2023, Eun Nguyen from Vietnam chose Korea for her first trip abroad since COVID-19 pandemic. The travel package included usual tourist attractions such as a city tour of Seoul, but it also included a more unique itinerary. The itinerary listing names of hospitals in the Gangnam district included things like body treatments of a Korean clinic and a facelift of a plastic surgery center. She thought it was a little bit pricey, but wanted to visit Korea that she became interested in through K-drama. She also heard about the glamour of Korean plastic surgery from friends who had already been in Korea through a similar medical tour. Of course, there were already several plastic surgery clinics in Vietnam which were operated by Korean doctors. But she thought it would be safer to go to Korea if she wanted to visit some plastic surgery clinics. When she landed at Incheon Airport, she was greeted by a tour guide who turned out to be not just a guide, but a medical coordinator who could also translate. After touring the Gangnam district, which is a hub of Korean plastic surgery, she arrived in Apgujeong, area where there are lots of buildings full of clinics, including plastic surgery centers. She was glad that she could use a hospital review apps before traveling around the area. There was a clinic which had an overseas branch in Vietnam, and many reviews of the center said it was very accommodating to foreign patients. When she entered the clinic, she was greeted by a counselor. Nguyen was a little nervous about sharing her personal information with someone she did not know well. Besides, the counselor wasn't fluent in either Vietnamese or English. So Eun Nguyen had no choice but to listen to the counselor's explanation on photographs, price, and others. The counselor even used the AI to show Eun Nguyen's before and after photos of her surgery in real time, and told that herself also had a plastic surgery at this clinic. Eun Nguyen couldn't help but be tempted by her recommendations. At first, she was only thinking about the simple procedures like a facelift. But when the counselor told her that it was a same-day surgery with a short recovery time, Nguyen decided to have her surgeries on her eyelids and eyebrows during a stay in Korea. Although this is just a fictional case, medical cosmetic tourism in Korea is now an internationally recognized tour item, which can be seen as a reflection of the growing global recognition of technical achievements of Korean medicine. It's a remarkable growth if you look back at the path Korean medicine has taken since the Korean War. However, with such a steep growth, there is always a downside.
Medicine in Multiculture.
In 1998, there were only 300,000 foreigners living in Korea. But by 2022, the number exceeded 2.26 million, with an annual growth rate of 9.2% over the last 5 years. The proportion of foreigners have been more than tripled from 1.1% of the registered population in 2006 to 4.8% in 2022. The globalization of healthcare in Korea is occurring on different levels, and the issues it raises are also multi-layered, with three main categories of healthcare necessity being related to foreign migrant workers, immigrant women in marriage, and medical tourism. Since the late 1980s, the number of foreign migrant workers in Korean society has increased year by year, with more than 1.01 million skilled foreign workers in 2024. Even if their health deteriorates due to long hours of work in poor working conditions, discrimination and low wages make it difficult for them to receive adequate healthcare services. As a socioeconomically vulnerable group, the question arises whether Korean society provides adequate healthcare service and guarantee health human rights for migrant workers. Due to the increase in international marriage since the 1990s, the number of foreign marriage migrants in Korea reached 174,895 as of 2023. This was encouraged by the government, as there was severe shortage in young generation in rural area. And many of aging Korean agricultural workers have difficulty in finding partners. So, local governments turn to arranged marriage, brings wives from other developing nations to Korea. In addition to language and communication barriers, economic problems and difficulties of migrating away from their social support network in their countries of origin, these migrant women face health problems during pregnancy and childbirth. However, they do not have adequate access to healthcare. Medical tourism in Korea, which has grown rapidly over the past decade in line with globalization, raised the issue of healthcare resource allocation. Since 2009, Korean government designated healthcare as high-valued service industry, among the 17 new growth industry to watch. Medical tourism in Korea has been growing rapidly at 20 to 25% every year for the past decade, with active support from the health authorities. Currently, the Korean government invests around 10 million won a year to attract international patients. As commercial medical tourism grows, the allocation of healthcare resources between foreign and local will be challenged by limited healthcare resources in Korean society, especially when there is already a large disparity between urban and rural areas. Investments will be focused on high-profit, state-of-the-art medical facilities, and skilled healthcare workers will move to areas where they can earn incomes from medical tourism and undermine healthcare service that local residents need.